Well, for my story, I've been in rural practice for about 18 years, and I've been treating opioid use disorder for about 12. For me, overall, it's been a positive experience. Some of the patients can be challenging and require a lot of patience, but overall, I've found the medication to be safe and effective, and to really make a difference in people's lives. It's not really something that I wanted to do from the beginning, or at least plan to do. But I've been noticing clinically a group of people who really seem to have a genuine problem in rural Oklahoma, and there weren't any resources available that met some of these individuals' needs. A lot of people who had the problem didn't really have the resources to be off work for a month and enter a formal treatment center in a distant community, and so it was really, I felt it was left really to our office to really do something for our own community if things were going to happen. So I took the treatment, and I think initially I was probably guilty of some of the stereotyping that I've heard from some of my colleagues when I've tried to recruit them, wondering about the type of person I'd be attracting into the practice, and I really found that my initial stereotyping was really wrong. These people are just like any other patients you have in the practice, and by and large they're very appreciative of what you can do for them. As Bill said earlier, most of them have started out in my practice anyway as or the people that I was treating were prescription substance abusers, but we are seeing more heroin patients. And my first heroin patient actually was a school teacher from a regional, another regional community here, and just seeing how this person responded to the therapy, I think really typifies the success that you can see with this type of medicine. I would say most of the people that I treat are on medication for less than a year. Some have taken it for several years, but most people want to wean off the medication at some point. And I think the benefits of this therapy really outweigh the drawbacks, and I think it's cost effective, and it's really amazing the change that you can see in patients' lives. Agreeing with Dr. Yarborough's comments earlier, in primary care you don't really get to engage in a lot of heroic medicine, but when you see the changes this makes in some people's lives, it really feels like you're doing something heroic when you take someone who is essentially homeless and treat their problems and help walk them through the process of getting back to employment and taking care of their families. It's really a special feeling. So I'll leave my comments with that.